Hi, I'm Jacob Gallagher. I'm a PhD student at the University of Iowa in the Department of Health and Human Physiology. And today I'm going to be talking about the barriers and facilitators of physical activities among rural American men. So since 1970, we've seen a decline in the mortality rate in the United States, but in the last 2 decades, we've seen this gap grow between urban and rural populations, where rural populations have a higher mortality rate due to higher rates of diabetes, cardiovascular disease, and cancer. So physical activity could be all ways to reduce these risks, but unfortunately, as we see on the graph on the left, rural populations are less physically active than urban populations. And so interventions that are tailored to rural populations have unfortunately not done a great job of recruiting men. And so when they do include men, they make up less than 1/4 of the sample, and in many studies, they don't include men at all. Men, however, are at a higher risk of cardiovascular disease, diabetes, and cancers as well, making them have 2 risk factors for these diseases. So the purpose of our study is to advance the understanding of rural men's barriers to and preferences for physical activity so that we can better inform future interventions and so that we can tailor them to rural men. So men who identified as living in a town of less than 2,500 people or outside of a town were then included in our study, and so including those men and those who passed the attention check, we had 447 total participants. In terms of measures, we had demographics, we asked about technology use and access. We then asked about common barriers to physical activity, and then we asked about common facilitators. And the key question here was asking their willingness to join a physical activity program. And this survey was largely adapted from Cadmus Bertram. So in terms of demographics, we had an average age of close to 35 years old, mostly non-Hispanic whites. We have a spread of education, spread of income, and we have over 50% having at least one child, mostly married, and full-time employment. In terms of were men interested in physical activity intervention, we see an overwhelming yes. So we have almost a fourth saying they're very interested, a third saying they're interested, and then another fourth saying they're somewhat interested, with a very small fraction saying they're not at all interested. When we asked them to pick their top 3 preferred physical activity modalities, walking was the top preferred, followed by running, biking, and strength training. When we asked them who they were interested in being active with, they said friends, with 2/3 were saying that, and then kids and partners being second and third. Over 3/4 of the rural men use broadband internet, with almost 12% using cell phones, and then less using dial-up or were unsure. Another promising finding was that about 98% of rural men said exercise was at least somewhat important to their health, so they're identifying that exercise is important to their health. What are their biggest barriers then? Well, the top-rated barriers were motivation, the cold, and being tired. Their reasons for joining a physical activity program include gaining fitness, increasing energy, and improving mental health were the top choices. When we asked them to rank what their preferred method to receive this physical activity intervention, apps, email, and social media came in the top, where Zoom, telephone, in-person, and group training came in later, or at the bottom. The key features that men wanted to see in a program included being able to have it included in their daily routine, teaching them how to exercise, and then being able to do it from home. So some key findings here, we can see that rural men are clearly interested in physical activity intervention, indicating that low recruitment and adherence may be due to a lack of tailoring of physical activity interventions. When we look at our other findings, we compare it to rural women, rural Wisconsin women specifically, we can see that barriers are similar. The reasons for joining a physical activity program are slightly different, with men having a greater focus on fitness and improving mental health, while women focusing more on overall health and losing weight, but both wanted to increase their energy. Preferred activities, both had walking as their top choice, but then men preferred running and biking, where women then selected yoga and strength. Limitations, we recruited through Amazon MTurk, and so we're not sure if this is reflective of the actual rural men, and they may be more tech savvy than the average rural man. For future investigations, we're really just beginning to understand this population and understanding their specific requirements, and so going forward now we can better produce interventions and help tailor them to rural men to increase recruitment and adherence to our programs. Thank you.